Can women also take finasteride for their hair loss? As far as female pattern hair loss is concerned, no one really knows what will work for one and not the other. 5 years back, when a lady would fly into my clinic from as far away as Bangalore, Vizag, or even Oman, I would feel miserably guilty. Guilty because so much money was spent in travel and time off work seeking a hair loss treatment. And when there was no clarity at that time of what will work for female pattern hair loss and what will not. Treatment of female pattern hair loss, even today, is mired in uncertainty and controversy. So trial of treatment is the common approach to female pattern hair loss. What will work for one may not work for the other. Over time, every clinic, every doctor practicing hair loss treatment in women has evolved their own unique protocol for treatment of female pattern hair loss using the doctor's best judgment and experience gained over many years. And doctors get frustrated when they find that nothing that they prescribe to the female hair loss patient seems to work. And many times finasteride prescriptions for female pattern hair loss are a last-ditch effort. And so is the case with spironolactone and use of oral contraceptives for treating hair loss. The truth is that finasteride was never approved by the US FDA for treating female pattern hair loss. So to know more about finasteride and female pattern hair loss, please hang on. And if you would like to stay in touch with my channel, please do subscribe and like this video. Female pattern hair loss is a very common entity with the hallmark of diffuse hair thinning, medically referred to as miniaturization of the hair, and shortening of the anagen phase of the hair cycle. And it is very much like that evidenced in male pattern hair loss. However, the pattern of hair loss, the design of the hair loss pattern is dissimilar. Thinning in female pattern hair loss occurring mostly in the occipital area and the parietal area, that is on the back and on the sides, and mostly retaining the hairline. And the prevalence of female pattern hair loss, unlike in male pattern hair loss, increases with age. At the age of 50, 50% of females suffer from hair loss. At present, the only approved treatment for female pattern hair loss is 2% minoxidil solution. And we all know that many times this minoxidil fails to achieve hair regrowth, not being in line with the patient's expectations from the medication. Finasteride, which is a selective 5-alpha reductase inhibitor, is therefore recruited as an adjunct or even at times as an alternative to minoxidil. However, there are three reasons why finasteride may not be the correct answer for treating female pattern hair loss. Firstly, the exact causation or the pathogenesis of female pattern hair loss is obscure. A relationship between the androgenic hormone and female pattern hair loss, though it is thought to exist, remains controversial. Evidence suggests normal androgen levels in those suffering from female pattern hair loss. With minuscule DHT levels, it becomes difficult to justify the use of finasteride in female pattern hair loss. The often mentioned hereditary nature of female pattern hair loss is similarly doubtful. Secondly, because of its potential to cause birth defects, birth anomalies in the male fetus, its use is confined mostly to women, not in the childbearing age group. Due to this inherent potential for teratogenicity, clinical studies to investigate the use of finasteride in female pattern hair loss are limited. Finasteride is classified as a class X drug for pregnancy, not only for pregnancy but also during the lactation period after childbirth. On the other hand, animal studies have shown dose-dependent development of hypospadias in male offsprings due to the inhibition of type 2 5-alpha reductase, that is, abnormal genitalia. No developmental changes were, however, seen in female fetuses. Lastly, and importantly, the use of finasteride for treating hair loss in women may tilt the estrogen-testosterone equilibrium in the body, the hormonal milieu interior, potentially increasing the risk of estrogen-mediated malignant transformation. So this drug, finasteride for treating female pattern hair loss, should not be exhibited in those ladies with a strong family history of breast cancer. Studies of finasteride usage in female pattern hair loss are few and far between, and they are not conclusive, to say the least. The risks of using finasteride for treating female pattern hair loss far outweigh the benefits we get from the use of finasteride in hair thinning in females. Side effects, on the other hand, are few and transient whenever they occur, and they may include loss of libido, breast tenderness, and excessive hair growth. Howsoever much I am against the use of PRP in treating male pattern hair loss, treating male pattern hair loss as the first choice of treatment, I increasingly feel that PRP may be the first line of treatment in some women who have refractory female pattern hair loss, not amenable to the traditional line of treatment. The only solace for female pattern hair loss, besides minoxidil, in the pre-menopausal state. My treatment of purified PRP with cell matrix, about which I will be talking in a subsequent video, works very well for my patients suffering from female pattern hair loss. We make our purified PRP ourselves in our own laboratory on the ground floor, the Hair Research Laboratory. Usually one treatment is required every month for 3 months, followed by 3 treatments at 3-month intervals. Subsequent treatments can be taken on required basis. This is the only treatment which, besides the other adjuncts, works well in my experience. And in an upcoming video, I will describe this technique in greater detail. Till then, if you have any further questions about hair loss, hair transplant and hair treatments in general, or about this video where I talked about use of finasteride and use of PRP for female pattern hair loss, please drop a comment in the comment section below and I'll be too happy to answer. Have a nice day and God bless you.